As we age, our vision definitely changes, and we may have to wear glasses to help us see clearly.
But what happens when the eye doctor says you have a cataract? Here to share more insight, Dr. David Dillman of the Dillman Eye Care Associates in Danville, and one of his patients, Jane Andrews. Nice to have you both.
Thank you. So there's a new procedure going around to do cataract surgery. Tell us a little bit about it.
Well, it's actually, Heather, it's kind of ironic because for years and years people have thought that they had a laser for their cataract surgery. In fact, they did not. But now we have a laser to help us with the cataract surgery.
And how different is it besides just being a laser?
It's incredibly different. Now, the laser doesn't do the entire surgery, at least not yet. It really does 4 of the main steps. But it does those 4 steps, I think, better than a human being can do.
And that's why more people are choosing this option and why you happen to do it, right?
Yes.
Okay, so it's more efficient. Does it help with recovery time?
The recovery time is about the same.
Okay.
Yeah.
And what is the procedure called, or the new laser called?
It's called a femtosecond laser.
Oh, I think we have video of of it being done there, if we can check that out. And Jane actually had this procedure done using this new technology. So what could you do before, or couldn't do before, that now you can do due to this surgery?
Well, I wore contacts for several years, and I had trouble seeing the distance of, say, street signs, or I'd have trouble seeing up close to thread a needle or something like that. And so now I'm able to do that without glasses or contacts.
Wow. So is it similar to LASIK in a way at all? Because that's odd that now she can see perfectly when before she was using contacts.
Right. It's really entirely different than LASIK, except a femtosecond laser is used in LASIK, and a femtosecond laser is used for this cataract procedure, but they're different femtoseconds.
So it's not unusual to not need glasses or contacts after having a cataract surgery?
Well, that's our goal.
Oh.
Yeah, no,
Cool.
and that's really important because, as I'm sure you would attest, Jane, this makes a big difference in your quality of life.
Absolutely. I've worn contacts or glasses since I was in 3rd grade, and now I am not wearing anything.
Wow.
And that says it.
That definitely does.
I wake up in the morning and I can see things.
Yeah. Which is awesome. And I'm sure you get pretty good feedback on this too, Dr. Dillman.
Yeah, the feedback has been remarkable.
Yeah, and you've done several thousands of these procedures, and you still seem to be excited about doing them.
Yeah, and Heather, the reason is real simple. And when doing my due diligence for this new cataract-assisted surgery, I went to 3 different cataract surgery centers, and I watched 5 different surgeons perform collectively about 100 surgeries. And I can tell you, in every case, the laser outperformed the surgeon.
Now, Jane, I also want to ask, too, you chose a special type of implant called a multifocal implant.
Yes.
And I'll let both of you kind of chime in on this. What is that, and what's the impact? Why don't I start with you, Dr. Dillman?
Well, most implants give a vision at one distance, usually either far away or up close. Yes. So that's one focus, if you will. A multifocal is what it sounds like. The intent of the multifocal is to give good vision at multiple distances.
Okay. And so why did you choose that particular option, Jane?
I was used to having a monovision type of contacts where I could see distant or near, and I did not want to give that up. And so I thought this was something that would work for me. And again, I see those street signs, or I can thread a needle.
Does it have any effect on your night vision?
Maybe just a little bit, but it's improving all the time, because I think I was told it could very well take a few months for everything to work together.
Oh, well, that's so fancy. It's amazing, the advances in technology over the years.
And this is still cutting edge, right? This hasn't gone mainstream yet, has it?
No, Matt, this was FDA approved about 2 years ago.
Wow, so recent.
Right. And the first year, there was a lot of bugs to work out, so I kind of let it ride for a little bit.
Yeah.
But last summer is when I started looking into it really seriously.
And you've done a handful of them at this point, so you've got the procedure down, and you know what the responses have been now from the patients.
Yeah. Well, actually, Matt, we've done about 200 now.
Oh my goodness, that's more than a handful.
Yes.
Yeah, that's yeah, you're a pro. That's really great. Good luck with this procedure, and Jane, congratulations on having this kind of newfound lease on life here.
It is. Thank you. I appreciate that.
Yeah, pretty neat.
I appreciate Dr. Dillman.
Yeah. Well, we do too. It's Dr. David Dillman and patient Jane Andrews, and they've been talking about the newest procedure in cataract surgery, femtosecond laser. So thank you so much. If you want to learn more and connect with Dr. Dillman and the Eye Care Associates there, visit CILiving.tv and we'll get you connected. Well, did you know that sleeve on your